Good afternoon, and thank you all for joining us today to talk about 0 to 3 State of Babies Yearbook 2020 and how data can be used to guide state policy and advocacy. I'm Jamie Colbard. I'm the Director of State Policy at 0 to 3, and I'll be moderating today's webinar. If you haven't already, please respond to the poll that's up so that we can get a sense of who's on the webinar today. While we wait for those results, I wanted to go over a few housekeeping items. We have a large group today, so everyone will be muted throughout the presentation. However, I encourage you to put questions for presenters in the Q&A box. We'll have a bit of time at the end of the presentations and try to get to as many of those as we can. Please also feel free to share reactions and examples from your own state and experience in the chat box that everyone can see as we go along. We are recording the webinar and we'll post it and the slides on the 0 to 3 website soon. We'll send an email with a link to those materials to everyone who registered. Let's go ahead and close the poll and take a quick look at those results. Thank you so much for completing it. So those are up on the screen now. It looks like our largest percentage are folks who identify themselves as early childhood service providers and advocates. We have some people working in state government and several people who selected other. If you'd like to share more, please go ahead and put in the chat what your role is. We'd love to see that. I'm really excited that we have a good cross-section of roles on the call today because we really see the State of Babies Yearbook as a tool that can be used for all of those groups. So I'm really excited to share this information with you and also hear how you will use it going forward. Before I introduce our presenters, I want to set the stage briefly with a brief description of the State of Babies Yearbook. This is the second year that we've produced a State of Babies Yearbook. It takes a holistic look at how our nation's infants, toddlers, and families are faring and shows that the state where a baby is born impacts their chance for a strong start in life. By nearly every measure across all states, children living in poverty and children of color face the biggest obstacles, such as low birth rate, unstable housing, and limited access to quality early learning experiences. The report further highlights major disparities that begin before birth, especially for Black children, driven by systemic racism and social injustices. And although the data presented in the yearbook is from before the COVID-19 pandemic began, we know that the health and economic crises the pandemic created have only worsened the challenges described in the yearbook. It has never been more important that we re-examine and strengthen the multiple systems that are needed to ensure every baby is able to achieve their full potential. The State of Babies Yearbook is part of 0 to 3's Think Babies initiative, which we created to make the potential of every baby our national priority. If you're not familiar with the initiative yet, I encourage you to visit thinkbabies.org to join us. And data and indicator analysis for the yearbook was once again powered by Child Trends, and we're so grateful for their efforts. And now I'm so excited to introduce you to our presenters. First, we will hear from Myra Jones-Taylor, our Chief Policy Officer, who will provide highlights from the State of Babies Yearbook, including a summary of findings, the impact of COVID on babies and families, and how states and others can use this data to guide policy and advocacy. Following Myra's session, we will hear from 2 state presenters about their experience using infant-toddler data, including State of Babies, in their advocacy and policy work. First, we'll hear from Laura LaCroix-DeLune, the project coordinator for the Minnesota Prenatal to 3 Coalition, and a participant in a new 0 to 3 initiative, Building Strong Foundations for Families. And then we'll hear from Michelle Ribis, the Policy Director for the North Carolina Early Education Coalition and a partner with us through Think Babies. Myra, I'll hand things over to you.
Great. Thank you so much, Jamie. I think one of my favorite parts of a webinar is the roll call. It's always so great to see so many different people who care about young children and their families show up today, so thank you. Our goal in developing the State of Baby's Yearbook was to give policymakers and advocates alike a tool they could use to do a few things. First, to tell the story of infants and toddlers nationally and in their state, using a comprehensive set of nearly 60 indicators across 3 policy areas. And then also to compare states' progress for infants and toddlers using a common set of indicators, which is really important that we're comparing apples to apples, of course. Then to identify indicators on which babies and toddlers are lagging, and then use this information to develop policies that help improve outcomes for young children. Depending on the state, this can mean building on the strengths of existing programs and practices or taking innovative new steps. It's also to use the annual yearbook updates to monitor trends in the experiences of young children and their families and track progress in states' policies. The yearbook includes nearly 60 indicators, again, across 3 policy framework areas of good health, strong families, and positive early learning experiences. Next slide, please. We were so pleased to be joined by Wes Moore, the CEO of Robin Hood and best-selling author, to help us put the State of Baby's Yearbook 2020 into context. Wes has thought deeply about the intersection of poverty and health and the ways in which our policies and our expectations can set children on radically different trajectories in this country. We were also honored to be joined by some of our Strolling Thunder families who shared how they are doing amid the COVID crisis. We had to cancel this year's Strolling Thunder, where a family with a baby comes from every state and the District of Columbia to tell Congress what families need for their children to survive. But we did stay in touch with our families, and we're so appreciative that several of them told their stories about how they are coping in such brave and honest ways. Several of our families have since connected with their members of Congress through Strolling Thunder virtual voices, and their stories have helped to make the case for increased funding for childcare in the latest federal COVID package. Next slide, please. The State of Baby's Yearbook 2020 takes a holistic look again at the nation's babies and represents a snapshot nationally and by state of how babies are doing, again, across 60 indicators of well-being in our policy areas of good health, strong families, and positive early learning experiences. And we did this in order to create a quick snapshot. We came up with the way we framed this is in terms of 4 tiers that are approximately equal in size based on the theme of grow. So G is for getting started, R is for reaching forward, I is improving outcomes, and W is working effectively. But we did some new things in 2020 that we're really excited about. First of all, for the 2020 yearbook, we refined and added some new indicators as we work toward a more complete picture of babies and families. But the most important addition was the disaggregation of as many indicators as possible by race and ethnicity, income, and urbanicity. We were excited to expand the functionality of our State of Baby's website as well to allow visitors to go to the site, to go beyond the state averages and see what often are very different experiences of babies in these subgroups. We continued to place states in tiered groupings, but kept the indicators on which those were based consistent last year. So even though we added a few, we made sure that we were doing the tiering across the ones that we had done in the previous year. We will continue refining the indicators, and we'll take another look at our methodology until we can rework the ranking system in a few years. So this is definitely an iterative, dynamic tool, but one that we know has been very useful to states. Next slide, please. So let's take a look at our key findings in good health, which is our first plank of our policy framework. The 2020 yearbook data indicate that infants and toddlers are doing well or have made gains in areas such as routine medical visits, although we see differences by subgroup. That makes the national picture very concerning with the impacts of the COVID-19 pandemic, including its effects on well child visits and vaccinations, something we're monitoring closely. And new data in the State of Baby's Yearbook 2020 confirms significant persistent disparities in maternal and infant health among mothers and babies of different races and ethnicities at both the national and state levels. We delve into the data in greater detail in a companion brief I'm so proud of, the companion brief to the yearbook, which is called Maternal and Child Health Inequities Emerge Even Before Birth. And I hope you all have seen that, or we'll take a look. Next slide, please. Significant disparities were found in maternal and child health. Here we take a look at them by race and ethnicity. So just a few. So in terms of late or no prenatal care, nationally, around 6% of women receive late or no prenatal care. While 4.5% of white women fall in this category, 7.7 or nearly 8% of Hispanic women and nearly 10% of Black women get late or no prenatal care. This is compared with Asian Pacific Islander women for whom they have the racial category with the lowest rate. Black women are more than 3 times as likely to obtain prenatal care late or not at all. American Indian women are more than 2 times as likely, and white women 41% more likely than Asian Pacific Islander women to receive late or no prenatal care. And we know that racial and ethnic disparities are even more pronounced in some states. In terms of maternal mortality, the national maternal and infant mortality rates are particularly concerning and are higher than rates found in other industrialized nations. Maternal mortality, which is a new indicator of the 2020 yearbook, occurs at a rate of 17 deaths per 100,000 live births nationally. And again, differences in how states report maternal mortality prevent comparison across rates across the state. So that is one challenge that we face. Next slide, please. Similar patterns to maternal health inequities are seen when we look at birth outcomes and inequities there. Like maternal mortality, our national rate of infant mortality is high at nearly 6 deaths per 1,000 births. And infant mortality is more than 2 times higher for Black infants than for Hispanic and white infants. In fact, in all but 5 states, the mortality rate for Black infants is at least twice that for white infants. It's very, very problematic. Next slide, please. We have concerns during the pandemic about the use of pediatric care. So I want to show what it was like before the pandemic by income levels. It's really important to understand what the context is going into COVID, right? So in terms of routine and preventative health care, medical visits, 91% of the nation's babies had a preventive medical care visit within the past year, which is quite good. But babies and families with low income completed visits at a lower rate of 87% than those in families above low income, which was 93%. So again, you're seeing some variability there. And during the pandemic, pediatric practices have reported dramatic drops in well child visits. So we will have to be very, very aware of that as we move forward. In terms of vaccinations received nationally, 70% of infants and toddlers received the recommended vaccinations. However, again, when analyzed by income, significantly fewer babies, 64%, in families with low income receive vaccinations than those in families above low income, which was at 77%. But in all states where differences exist, children in families with low income are less likely to be vaccinated than children in families above low income. Next slide, please. So let's move on to strong families. Young children develop in the context of their families. You all know this so well, where stability and supportive relationships nurture healthy development, and their family's ability to nurture them is in turn influenced by the community environment in which they live. Most of the indicators in the Strong Families Framework area point to many challenges. While there are some positives, often when we look more closely at race and ethnicity or income, we see a very different story. And one example is found in families' resilience. So in terms of families' resilience, more than 4 out of 5 families, or 85%, with an infant or toddler report a favorable level of resilience. But fewer families with low income, 79%, characterize themselves as resilient than families above low income, which is at 89%. So again, that variability is really important to tell the full story. And variation across states is also as high as for low income families, ranging from 60% of families in Arizona reporting resilience to 97% of low income families in Alabama reporting the same. Supportive policies are critical. We know that all families benefit from parenting supports, and many, particularly those challenged by economic instability, require additional support that help them meet their children's needs. And we found key supports like home visiting services, paid sick, family, and medical leave, and income support through tax credits did not have a great reach because they serve few families or were adopted in relatively few states. So this is a huge area of growth across the country. Next slide, please. We know, of course, that babies are uniquely sensitive to challenges in their environments, and several, such as economic insecurity, negative housing circumstances, and early experiences of adverse events, can jeopardize development. And many families with infants and toddlers lacked economic security. 1 in 5 babies lived in poverty, but Black babies were or are 3 times more likely to live in poverty as white infants. And Hispanic infants and toddlers are more than twice as likely to live in poverty as white infants and toddlers. And wide variation exists in the proportion of families in poverty with a child under the age of 3 that receive TANF benefits. From 2.7% in Idaho, so those families who are eligible who actually receive it, to 88% in Maryland, a huge range, reflecting the different emphasis states place on TANF funds for income support. This, of course, is of great concern as we are in the middle of a pandemic and an economic crisis. Infants and toddlers of color, in addition to living disproportionately in poor families, are more likely to live in neighborhoods in which their parents characterize as unsafe, also to experience housing instability, and to have been exposed to 1 or more potentially traumatic experiences. Go to the next slide. Oh, I beg your pardon. Actually, Katrina, if you can go back. Families at the poverty level receiving TANF, nationally, about 22% of families with infants and toddlers living in poverty received income-based TANF supports. Again, when you disaggregate by race, we could not do that with this information, with this report, but recent research indicates gaps in the percentages of white and Black families who benefit from TANF cash assistance, and finds that states with higher concentrations of Black families are less likely to have cash assistance as a priority. So it's an interesting thing to track. And these states also instead prioritize spending on discouraging single parenthood, which reduces the gap to a lesser extent. In terms of crowded housing by race, this is another one we track very carefully. And nationally, 15% of infants and toddlers lived in crowded housing. However, when you examine by race, this reveals that significant differences in which babies were more likely to live in this condition. So Hispanic babies were 29%, were 3 times more likely to live in crowded housing, and Black babies at 17 or 18%, and other race babies were twice as likely to live in crowded housing than white babies. Next slide, please. We looked at indicators of strong families. Several could be determined by income level, comparing babies in families with low income to those in families above low income. And babies in families with low income were surrounded by less secure environments. So for just a few key figures here, they are 3 times more likely to live in crowded housing, twice as likely to live in unsafe neighborhoods, and 3.5 times as likely to have 2 or more adverse childhood experiences. And as we mentioned before, they are significantly less likely to live in families who say they are resilient. Next slide, please. In terms of our positive early learning experiences, we know that infants and toddlers, and I know you all know this, learn through play and active exploration of their environment and interactions with the significant adults in their lives. And the quality of babies' early learning experiences at home and in other care settings has a lasting impact on their preparedness for lifelong learning and success. Because babies' early experiences are so influential, parents who require childcare while they work or attend school need access to affordable, high-quality care options that promote positive development. And as a country, we all know we are not ensuring positive early learning experiences. And early inequities are found when we look at babies across different income levels. Next slide, please. So we were able to look at 3 indicators by income. Despite the importance of early learning that takes place at home, surprisingly few parents report engaging in daily reading or singing with their babies, interactions that are closely related to children's language development. So in terms of one of our indicators, reads every day, we found that nationally only 37.8 or 38% of infants and toddlers are read to every day. And parents above low income are 52% more likely than low income parents to report reading to their babies. And this is something that we've been sharing. This is something that can change really from one night to the next through really effective promotion of these practices and the importance of this. In terms of sings every day, more parents talked and sang to their children than read to their children, which is still a very important way of promoting literacy and those connecting bonds that we know are so important. In terms of early identification of developmental delays and intervention, these are essential during the critical period of rapid growth in the baby's first 3 years. And babies who are screened are more likely to have delays identified, be referred for early intervention, and be determined eligible for early intervention services, which we know are so critical for young children's success later in life. In terms of developmental screening, early intervention efforts also differ across states. Despite the rapid pace of development in babies, we know that there is great variability there. New and modified indicators in the 2020 yearbook shed additional light on screening, as well as the timeliness and receipt of IDA Part C services. So quickly, nationally, only 31% of infants and toddlers ages 9 through 35 months received a developmental screening in the past year. And the percentage who received a developmental screening range widely among states, from as low as 16% in Florida to as many as 60% in Oregon. And then additional inequities can be identified. Babies in families above low income are more likely to have a developmental screening than babies in low income. So again, there's that disparity there. Next slide, please. We know that early care and education opportunities are critical, and the extent to which states support families in accessing and affording early care and learning opportunities varies again significantly by state. And children and families with low income particularly can benefit from high quality early care and learning opportunities, but they are less likely to have access to these programs in care settings. In terms of early Head Start, we know that infants and toddlers and families with low incomes or incomes below the federal poverty level are eligible for early Head Start. However, only 7% of eligible infants and toddlers have access to early Head Start services. And again, this ranges greatly from a low of 3% in Nevada to 23% in the District of Columbia, but still grossly inadequate when you consider how powerful early Head Start is for families. And then, of course, we know childcare costs are so high across the country, and they exceed 1/3 of a single parent income in several states and cost more than college tuition in 28 states and DC. And despite the high cost of infant care, few families receive financial assistance. Only 13 states allow childcare subsidies for families with incomes above 200% of FPL, approximately $50,000 for a family of 4. You all know that. In terms of childcare quality, only 2 states have adult-child ratios that meet or exceed the standard set by Early Head Start, which is 1 adult for every 4 infants and toddlers for babies at all ages under the age of 3. And we, of course, are worried about that as we're in the middle of the pandemic, and many states are thinking about changing their regulations in the midst of this, which is definitely not where we want to go. We do not want to increase those ratios, right? And then 1 state has group size requirements that meet or exceed the standards set by Early Head Start. And that is just, truly shameful, not good enough. So even as we release this data, we know that the recent impact of COVID raises new challenges for families with disproportionate impact on those who are most overburdened and under-resourced. In all of the areas that we have covered today, we have new concerns that are not captured in the yearbook data. This includes new challenges in health access, including difficulties surrounding prenatal care and birth, and a drop in access to preventative health care, including childhood vaccinations. We're also very concerned about greater economic insecurity for families, worsening inequities, and causing stress and trauma that can be detrimental to early development. And of course, we are very concerned about increased child maltreatment. Even as rates of reporting may drop, we're very concerned that there are more children who are being exposed to maltreatment as a result of this crisis and the stress that it has brought along. And then again, also lack of access to high quality, safe childcare that supports children's healthy development for working families, and broader concerns about the sustainability of the childcare field as temporary closures may become permanent. And we are seeing that across the country. Finally, we are pleased that, like the initial 2019 yearbook, the release of the 2020 yearbook has received an overwhelmingly positive response, and that the data are being put to good use. And we hope those of you on this call will will continue to use this resource if you have been, or use it for the first time if you haven't. We intentionally expanded the functionality of our stateofbabies.org website this year to allow users to more fully explore the indicators, particularly viewing the data for subgroups. And we continue to add tools to help states understand and utilize the data. We hope in the coming years to further enhance their interactivity and data visualization on this site, so stay tuned, lots of exciting developments. We have been so encouraged by the active use of the data, of the yearbook data, by advocates for babies. And just one thing I'd love to share is, in the first year, we heard from a West Virginia agency leader that the release came just as West Virginia lawmakers were considering expanding Medicaid coverage for pregnant moms up to 300% of the federal poverty level. And using the state's low ranking on health indicators to inform the legislature, advocates there reported that lawmakers passed that bill. And of course, there's a lot of advocacy that went behind that. We were so happy that the yearbook was able to help with that final push. We encourage you to use this tool and many others, obviously, to do in your own advocacy. Finally, I will say, we hope that you will use the SOBI data, we call it SOBI here, State of Babies data, as you advance an infant-toddler policy agenda in your state. And in a moment, you will hear directly from state leaders about their experiences using the State of Babies Yearbook and other resources of infant-toddler data to inform policy. The state 0 to 3 has provided several online tools that can help you use this data in your state, including state-specific profiles that can be shared with decision makers in your state, planning tools, including a profile navigator, overview of promising state policy approaches, and a state policy self-assessment tool, which our state team led by Jamie has just done an incredible job developing. And then ready-made advocacy tools, including social media posts and sample emails to policymakers. We are so grateful for all you are doing for babies on behalf of babies in your states, and are just now so excited to hear from some of your colleagues who are making it happen in states across the country, and specifically North Carolina and Minnesota. Jamie?
Thank you so much, Myra. And I will just note, I've seen a couple questions come in that we will get to at the end, but I will share that on the State of Babies Yearbook website, part of the yearbook is a detailed description of the methodology and the data sources. So if you have questions about how indicators are defined or where we're pulling the data from, I encourage you to look there. The state profiles also show how your state is landing on many of these indicators, so you can look there to see if, your state, where you fell in that list. But now I'm happy to turn things over to you, Laura. Thank you.
Great, thank you. Well, good afternoon. I'm Laura LaCroix-DeLune, and I am the project coordinator for the Minnesota Prenatal to 3 Coalition. So I'm very excited to be here representing so many colleagues around the state. What I wanted to do is, I won't spend as much time diving into the details of the data today. Instead, what I wanted to do is share our experience of exploring what stories can be told and what stories can't be told based on what data we have. So this event, our search for data on infants and toddlers really began when we attended the first release of the State of the Babies Yearbook in 2019. And a couple things really stood out to me when I attended the event, is that finding consistent data for infants and toddlers 0 to 3 was really difficult to come by. We don't collect it consistently across the states, nor even within the state of Minnesota. The other thing that really stood out to me in 2019 was the fact that Minnesota looked like everybody was doing well. So we have about 210,000 babies and infants and toddlers. About 32 to 33% of the state represents communities of color. And so when you look at an average, it really masks what's really happening in different communities across the state. And our coalition was really focused on inequities in race, economics, and geographics. So we really wanted to be hold up and disaggregate data differently. So when they announced, when 0 to 3 announced that they were going to disaggregate data for the 2020 State of the Babies Yearbook, I raised my hand right away and said, please, let's work together and figure out how we can begin to share some of these untold stories about infants and toddlers. So next slide. So what we really wanted to do, as I said, is really focus on what stories can we tell, and how do we use the data we have to improve both programs, but also the policy decisions. And we also wanted to explore, as we went into this work, is what's the negative impact when we don't have data on infants and toddlers and families. So traditionally in Minnesota, we were reporting on young children 0 to 5, but there really is a different story to tell around public investment when you look at 0 to 3 and when you disaggregate by race and geographic and economic regions of the state. Next slide. So we started down this road with 0 to 3 and some of our statewide partners to really explore what it is that we do know about infants and toddlers. We were very excited to use some of the data from Minnesota. So we used our specific Minnesota data from the State of the Babies Yearbook. We also used our Kids Count data book in Minnesota, which is really focused, we really pulled out the economic data from the data to help overlay that with the State of the Babies Yearbook report. And then we had another report called Risk, Reach, and Resiliency in Minnesota. And this took data by county. So we got a statewide lens and helped us really take a look at that. And then it overlaid the counties with our 11 tribes. So we have 11 tribes in Minnesota, so we were able to see where counties intersected with the tribes. And then we also have 2 major areas, urban areas, where our Native American families tend to live, both in, we call it the Twin Cities region, and then we have another major region in Minnesota, or greater Minnesota, North Minnesota, where they tend to live. So it was important for us to take a look at these 3 different types of data and how they told the story a little bit differently. A couple things I want to highlight, I mentioned to you already, we are really focused on inequities. And when you look at our overarching data, you can see that generally families are doing well. We have a very large number of families who are on Medicaid because we did the Medicaid expansion in Minnesota. We have it up to 283% of federal poverty guidelines. Only 5.2% of Minnesota's children, infants and toddlers, are uninsured. And yet when we disaggregate that, both our Latinx and American Indian communities are still lagging behind on those indicators. Food security for Minnesota, we're at again, the aggregate is 10.5% of infants and toddlers are experiencing food insecurity compared to 16% nationwide. And then prenatal care, as you saw those numbers or the percentages, what we see in Minnesota is that our Latinx infants and toddlers and the Black women, American-born, African-American women, specifically in Minnesota, have much higher rates of maternal mortality as well as infant mortality. So we can see that overall, when you look at the numbers, things look good. When you start to disaggregate and dig a little bit further, we're not doing so well. The other thing that we wanted to highlight in this experience is, so you see the out-of-home placement rates was another area that we were exploring. We have about 1 in 5 babies who experience more than a year, so between 0 and 3, more than a year in out-of-home placement. And that is higher, again, in our Black community and in our Latinx community, and significantly higher in our Native American community. So we wanted to be able to dig into that and understand that data. And then for one of the things that I think is important for our colleagues to know around this country is our early learning opportunities in Minnesota had been significantly impacted in 2003 with a major budget deficit back then. And I am sad to report, even though we are in compliance with federal minimal compliance with CCAP, we are still paying childcare providers and teachers less today than we did back in 2003 before we made these cuts. So we know that data matters, and it will continue to have an impact year after year after year. So we explored not only the negative things, but the positive things. But I don't have enough time to go into all the positive things that are happening. So I wanted to go to the next slide so we can talk a little bit about our experience in thinking about the data that's missing. So for us here in Minnesota, we really wanted to highlight the fact that we have no statewide database to really collect information about infants and toddlers or young children. So we don't have one place to collect our public health data, early learning experience data, referrals for interventions. We don't have a space for that. So there's been a lot of interest in working with folks at the state through the Preschool Development Block Grant to see about the possibility of moving something like that forward. But not having data available in easy, accessible ways has made it difficult for policy and decision makers to move forward. The other thing that we highlighted as a negative impact is it's very difficult for us to have data on Native American infants, toddlers, and families. Data is collected differently across the 11 tribes. We have 7 Ojibwe tribes, 4 Lakota tribes. They collect information differently. Some of them use IHS, some of them don't. Some of the data gets reported to the states. And because the population overall in the state is low, what we tend to do with data is just not report it, right? So we're always worried about having identifiable data. But when we don't report on entire populations, they're not part of the policy solution. So we really wanted to dig into that experience and figure out how we could collect data in a way that was both respectful and meaningful to the community. And then the other piece of work that we did is share some emerging work in Minnesota, which is led by our Lieutenant Governor and Commissioner Lucero. They have created a new COVID-19 database to try to track the impact COVID is having on families. They are tracking COVID cases and disaggregating by race and by geographic region and economic regions. They're overlaying that with the unemployment data. And then looking at worker characteristics and also examining the homelessness data that we have. And in that data, what we have seen is that our Latinx community in Minnesota across the ages, 0 to 5, 6 to 19, 20 to 45, 45 and over, are 8 times more likely to test positive. And our Black community members are 7 times more likely to test positive. And again, this is consistent when we look down to our babies and young children, 0 to 5. We also know that looking at this data that our Black workers, 1 in 4, are more likely to apply consistently for UI benefits, for unemployment benefits. And we know that this will have a long-term impact on a family's ability to access resources for their families. And then 40% of our Indigenous families have consistently submitted for UI benefits. So with what we have begun to do as a result, you can go to the next slide, is try to dive into how do we collect the Native American data that I said was missing for us in Minnesota, and then use that and overlay with what we do know based on the State of the Baby's Yearbook and these other data sets that I mentioned and reports. So we're taking a look at that and have actually had to begin to have individual conversations with each of the tribes and with Indian Health Services to try to get information because, again, like I said, it's not consistently collected or reported, and state agencies. So we're taking that heavy lift with our partners through Indigenous Visioning, who are leading that work with us. So we hope to, by the end of next month, have some really solid data as a beginning point. But solid is we'll have some nice solid indicators that we can lay over with the SOBI report. And then the The disaggregated COVID data is the other piece that we will be looking at as we build our policy agenda for 2021. Minnesota, like most likely every other state in the nation, is facing a budget deficit as a result of COVID. We know that there is limited investments in infants and toddlers, and we feel strongly that we can now take a look at the data that we have before us and work to collect the data we don't have to tell a different story, to start sharing those untold stories and to start developing policy strategies that will really begin to address these inequities that we face on a annual basis in Minnesota. So we're trying to dig into them and make an impact with data. So, and my last slide is just simply some contact information for us. So you can see here, we have our website and our key partners, the Children's Defense Fund Minnesota and West Central Initiative.
Laura, thank you so much for sharing all of that. And I'm just so excited for all the data work that you've been doing and all the partners that you're bringing into it. And I just think that's so important. So I really appreciate you sharing your perspective. Michelle, I'm going to hand things over to you. I know we have a couple questions that have come in through the chat, so I encourage everyone to continue to put those in, and we will have some time at the end to try to get to those. All you, Michelle. Thank you.
Well, thank you, everyone. It's my pleasure to be with all of you today. North Carolina is a proud Think Baby state, and our organization is proud to serve as a backbone organization for our Think Babies Alliance in North Carolina. So I am going to just give you an overview of how we're using the State of Babies data in North Carolina for advocacy and policy change. And I wanted to start with this slide. This is a photo of baby Elliot. That's one of our staff person's babies. And it really just captures for us the possibility for babies to reach their full potential and the possibility for all of us when we invest in babies and families. And, you know, during COVID, we do almost weekly webinars. And so, you know, this keeps us going, right? To have this moment of joy, to recognize there is a light at the end of the tunnel. And maybe it's worth sometimes going through the tunnel to see what's there. Next slide, please. So for us, really, and I think you've already heard, the State of Baby really tells the backstory about babies and families. And we have used this data in all kinds of ways with policymakers, with local advocates across the state. We've used the data to inform our policy agenda. We have developed county State of the Baby fact sheets using those key indicators wherever we could get county data as well. So it helps us take a look at that picture. We know that disaggregated data is not always available, but it's so exciting this year to begin to get some of that disaggregated data, and it encourages us now to push at the North Carolina level and at the local level to see how can we get at better understanding of how all of these issues impact different segments of our community. So we really want to continue to do this drop-down approach and go deeper and wider. I want to just say we are now using all of this work in our Think Babies leadership team, racial equity work. So we're really able to center the data now in our equity work, and we really are indebted for State of Babies for leading in this way. Next slide, please. So, you know, I think, you know, one of the significant indicators is always poverty, and we've always looked at poverty and we've looked at it in terms of disparities, but to really hold it up, I think is important. This is just one of the pullouts from the North Carolina report. It's very important to point out the disparities between white babies and Black and brown babies who are furthest from opportunities. And here you can just see the dramatic difference in North Carolina. 39% of babies in North Carolina, Black babies, live in poverty compared to 12%. When we look at our counties, we have 100 counties in North Carolina. We have some counties that are majority minority counties where 60 to 70% at least of brown and Black babies are living in poverty compared to white babies in that same county. We are now in our work really talking about targeted universalism. So when we develop our policies, we're looking at policies that address the issues all babies face, but trying to understand what more we could do to address disparities by income, race, and zip code. And in our state, maybe like many of yours, there's a big urban-rural divide, especially around the availability and access to services. So these are the under-resourced counties with the greatest disparities, and really the families and children in those counties are the most extremely under-resourced children and families. And so we're beginning now, and I mentioned our racial equity work at our leadership team, to not just talk about race, but to talk about structural racism, and how is that operating in these systems. But starting with the data leads you to have those conversations. Next slide, please. We were so thrilled to see the maternal and child health report this year. Healthy Beginnings is the first pillar of our work in North Carolina. And this data is really moving our understanding on this issue through data to policy change. So this slide just gives you some of the indicators we're using to look at maternal and child health issues, and then how we are tracking that into our policy priorities. So in 2019, sorry, now I'm under COVID time. I don't remember when anything happened anymore, but in 2019-20, these were our top line policy solutions to expand Medicaid eligibility and the length of coverage, to ensure workplace accommodations. Here's one you might not think about, but just doing better workplace policy to accommodate pregnant employees can make such a difference in the ultimate maternal and child health outcomes. Of course, paid family and medical leave, this has been at the top of our agenda for a long time, and expanding access to home visiting. So we think we package all of these policy priorities together, we'll be able to significantly address these outcomes for children and families in the future. Next slide, please. So in North Carolina, and maybe like your state as well, policy makers always want to know, how do we compare nationally? So this report's useful for that every time. And how do we compare to other states in the Southeast region? We have that same dynamic among counties, right? Counties are always juggling to be at the top of the list. No one wants to be at the bottom. So, obviously what stands out in North Carolina out of this report is our state's infant mortality rate. And for Black babies, it's twice as high as white babies in our state. And this issue has gotten a lot of attention. It's also a priority in our state's early childhood action plan. There was a whole series in our paper, our major newspaper in our major market on the infant mortality rate. It also looked at Black infant mortality rate, but by adding this regional context to this story, it gave us another way to link to that media coverage, and it helped us link back to our policy priorities. So while we're debating in the legislature and the governor about expanding Medicaid, we could say, this Medicaid expansion is the solution to our infant mortality problem, which has been so well documented. So we could just springboard from this issue through state and regional context. And among our Southeast regional peers, we are also the worst. So that state policymakers didn't like that enough to change our Medicaid policy, but it gave us an opportunity for discussion. So next slide, please. So the second pillar of our work is strong babies, and we really are strong families to support healthy babies. And this is just a quick look at how North Carolina is focusing on this issue. So again, we just aggregate by race. We show some of the positive indicators and some of the negative indicators in all of our work. And then we tie it to our policy agenda. And here our policy agenda focuses on home visiting and parenting education. We also really wanted to dive deeper into the maltreatment data for infants and toddlers. So we had a special pullout on infant and toddler, because previously our state was only collecting that by all age children, 0 to 12. So we got it not only down to 0 to 3, but by county. And this is leading all of us to really this year and into 2021 to talk about how we have to make sure concrete economic supports are really part of our future policy agenda. I'd also say sometimes the state babies data prompts you to take a look at why does your state look the way it does. For good example for us is we don't use a TANF indicator, but it led us to having a good conversation about like what has happened to cash income assistance in our state, and it has pretty much disappeared. But we weren't prompted to look that way until we got this State of the Babies report. Next slide, please. So the third pillar of our work is quality early learning, and I'm sure for all of you, COVID-19 has just created the childcare crisis. The childcare was already so challenged right before COVID, right? Childcare programs live on such a thin margin, and yet we are seeing the collapse of childcare in our state and in our counties as a result of the COVID crisis. So we always looked at how expensive childcare was in our state. It's very expensive in North Carolina. You can see the 40% of a single parent's income. We can put that together with our childcare subsidy data and our eligibility data. We put it next to our childcare desert reports. We use the report that came from the Center for American Progress on that to really just hone in on some of the particular aspects of childcare. We did a special data run, even though we could get the data on how many programs have opened, reopened, and even at the county level, we could get that. We didn't know for what age population. So we had to request and get a special run on slots in infant-toddler care. And in June, we knew that we had lost 30,000 infant-toddler slots. So we were a childcare desert before in all 100 counties. We don't know what this is really going to look like come the fall or come next spring. So that data is very hard to get, but we want to get at it for this capacity building work that we're going to need to work on to rebuild. And of course, it's taking us now into, well, what other forms of both family support and childcare do we need to really make this whole notion of childcare as essential come alive and be funded in a way that really demonstrates equity, but also the potential impact that we know childcare can bring in terms of children's future development. Next slide, please. So in our work, we always pair the data with stories. It's really so important to gather these stories from people who are living these experiences, because that illustrates what's happening to babies and families. And honestly, for all the legislative meetings and hearings I've been in, stories are what policymakers repeat when they're making a case for a particular policy or taking just a public moment to talk about the state of babies or young children and families, even though it's the data that actually motivates them in terms of the breadth and depth of the data, like how pervasive, how big is this problem? We try to get constituents to talk to their own policymakers. Nothing's more powerful than that. And we give them lots of ways to be able to do that. We are big on petition drives where we can just collect a lot of information and stories from people. We do listening sessions. We do them almost monthly with different affinity groups like childcare programs or parent groups. We also have an action center, an advocacy action center. And increasingly, we're going to videos using other voices, of course. And then Elaine, the mom of that baby that you saw earlier, is able to put some of those stories, facts together with just statements that we put up on our social media. We use them in our policy presentations and our webinars, which really just captures the story about any particular issue we're trying to feature. Next slide, please. So we are really an advocacy organization at our heart of hearts. And so we're always trying to figure out how do we engage more advocacy partners to tell their stories, to use the data. During the legislative sessions, we run a campaign that we call Tuesdays for Tots. So it's every Tuesday, usually at 2, if we can make that happen, where we want people to think babies. Here's our April webinar series, just so you can take a look at it. We focused on the state of children, how to be an effective advocate, making kids count. The census count was in swing then, and also taking advantage of it being Child Abuse Prevention Month, so we could focus on the data we had there. So we're looking for ways to continue to put issues, data, stories, and policy solutions together and in the forefront of our work. Next slide, please. So next step for us really is to continue to use the data to inform and build out our policy agenda. We have so many more data needs that we'll look to Think Babies and 0 to 3 and other national organizations to help us get to. Disaggregating data is so critically important, and we need it in all areas, not just in our child health area, where in our state that's the best disaggregated data. And we need to continually push to drop it down to the county level, and that's even harder to do. We're going to continue to collect voices from the field, as we call it, and we are now, we have been embarking on a regular advocacy training series where we teach people how to put all of these pieces together. And we launched a special curriculum and an advocacy training series that's up on our website if you want to take a look at it, that we did with the R&R community. So we had training in every region. So next slide. I'll just stop here with just our contact information and just share with you something we live by, because we know that a small group of citizens has changed the world. We are changing it for babies. We are so thankful to be part of this work, and appreciate all of what all of you are doing around the country as well. So thank you for this time today.
Thank you so much, Michelle. We only have a couple minutes. I do want to address a couple of the questions that came in. One, a few people asked about how we decided which indicators to disaggregate, and I will just say that we wish we could disaggregate all of them by race, ethnicity, including American Native and Alaska Native, urban, rural, and income. Unfortunately, we're constrained by what the data sources, the national data sources that we pull from allow, and by sample sizes. But I think we've just heard from both Michelle and Laura about how they're pairing state of babies with additional data that they collect at the state level, or that allows them to dig deeper to the county level. So I would encourage you to think of the yearbook as one tool that you can use, but you may have more detailed information that is collected at the state level that we aren't able to include because we sort of have to only use data that is for all 50 states. There was one question, Michelle, if you feel like you can answer this in a 30-second response before people sign off, but there was a question about the 30,000 childcare spaces that were lost due to COVID, and whether you know how demand has also changed. I know that's a big question, but if you have a few thoughts you want to share.
Sure. I mean, I think that's the other part of the equation. What does demand look like? And, you know, the demand data that we can get now is really looking at enrollment. And in all of our childcare programs, vacancy rates are, you know, high, 50 or 60% more. So we know families aren't enrolling or re-enrolling their children in childcare for a variety of reasons, which are only anecdotal at this point. We don't have the data. You know, some of it is just, it's COVID. It's still rampant in our state. So returning an infant or a toddler back to formal childcare, we know that that's not a health or safety choice for many parents, and we can't do social distancing. So it makes total sense to me that if you have another option, you might not be using that one. But I think it's also that we don't have any good ways to track demand data. You can look to your childcare resource and referral system, but it's really just those parents who are calling some kind of a central number to inquire about what available childcare looks like. So that's a whole other area where we need to do a lot better job of on the demand side. The supply is what we need to track, because before COVID, we knew we had 250,000 children of working parents and parents using our formal licensed childcare system. That is down to about 100,000 now. And with half the programs in our closed not open, but not likely to be able to stay open. We need to take care of both sides of this. But at this point, I think it's the supply we need to worry about, because we won't have infant-toddler childcare in the future if we don't.
Yeah. Absolutely. Thank you, Michelle. And I want to reiterate what Myra had shared earlier as well about just the importance of really using this data. There are really critical decisions being made right now about state budgets, about the federal response to COVID and further support for families and for states in that. So I just really encourage you to dig into this and to share it with people in your state, with your members of Congress. There's a poll up there right now where you can sort of share your current thinking on how you'll do that. I will note that we have a webinar planned next week that is specific to California, that will look into California data. So a few people asked about California things, so we'll follow up with the link to that for those of you. And I'm sorry we didn't get to all of the questions, but we will try to circle back on some of those in some of the follow-up materials we do. So thank you all so much for joining. Thank you again so much to Michelle and Laura and Myra for presenting. I hope you all have a wonderful day.